As a cleaning industry professional, and especially for those watching right now who are ISSA member organizations, what is your focus? It may align with the ISSA brand promise, which is changing the way the world views cleaning. How do we make real change? It comes with initiatives that focus on improving what we do in the industry. The EPA Safer Choice program is one such initiative that is in the spotlight today. Yet you might say, I've heard about this program years ago. That may be true, but some emerging news has amplified the reach and value, and you will want to hear about it today. But I'm not the one here today to divulge what this is. Let's welcome our three panelists. Let's start with Dr. Gavin Macgregor-Skinner. Gavin, tell us a little bit about yourself.
Yeah, hi, Jeff. Happy New Year. I'm the Senior Director at ISSA, and I collaborate with both the people on this panel today in a project called Making Safer Choices.
Thank you. And Dr. Rebecca Bascom, can I call you Becky?
Sure.
All right. Tell us about yourself.
I'm a professor of pulmonary medicine in the Department of Medicine, Public Health Sciences at Penn State. I'm also a lung doctor and delighted to be working on this project.
Glad you're here with us. And last but not least, Dr. Omrana Pasha-Razzak, tell us about yourself.
Thank you so much for having me, Jeff. And it's a pleasure to work with Gavin and Becky. I am a professor at the City University of New York School of Medicine. I am an internal medicine physician, an internist, and an epidemiologist. I work in the Department of Community Health and Social Medicine with a focus on underprivileged and vulnerable populations.
And you really like women's health too, and mothers and children. That's
Right.
one of your big things, which I think is completely pertinent for this project.
Because 80% of people who are directly involved in the cleaning process are actually women.
I think what people now understand is that the three of you know each other pretty well.
We do.
Very
So
good.
Gavin and I worked together at the pandemic, the time of the pandemic,
Mhm.
and had a very similar focus, which is how do you come up with practical approaches to big problems? And COVID clearly was a big problem, and cleaning is something that so many people do. And there's so much progress that can be made. And I think I like this project because it's practical and it's connected to the real world through ISSA.
Appreciate that. The only thing I wish is I had doctor before my name, but I'm just gonna have to put up with not having that. So, uh,
Yeah, but
but
you're editor, so you've
oh,
got the
okay,
big
okay.
power.
So we've teed this up a bit. We're now interested in what this news is. We all know what the EPA Safer Choice program is. Dr. Gavin, tell us about this big news that we're going to get into.
Jeff, so we have a project that we've been working on. It's called Making Safer Choices, but two significant events happened in 2024 that we wanted to share with everyone. So in April 2024, the federal government directed that all federal agencies need to prioritize and purchase sustainable products and services. And the change that was reflected in the US General Services Administration. This is the organization that does all the government contracts. So they oversee 600 cleaning service contracts for more than 1,500 US government buildings. It's about over $400 million annually. They mandated the purchase and use of cleaning products and hand soaps that are certified with eco labels, such as the EPA Safer Choice and a couple of specific Green Seal certifications. So that happened in April. Then what happened in December 2024 was that the National Defense Authorization Act for the fiscal year 2025 went through the House of Representatives, to the Senate, over to the President, and was signed into law December 23rd, that authorizes the appropriations for all military activities in the US Department of Defense. And there's a section in that act that says the Secretary of Defense shall procure, to the maximum extent practicable, only those cleaning products that are identified under the Safer Choice program. And that's what we're doing. So now we have both federal government buildings as well as all the military installations. There's military installations, military buildings, as well as aircraft carriers, planes, tanks, cars, vehicles in every state of the country now. A great opportunity for the whole industry as well as academia, the university partnerships we have to help people create new contracts and make safer decisions.
Well, this is big news. Gavin, thank you for sharing that. Dr. Beck, anything to add?
Well, I think that when I hear about a program that reaches so many people, I think it's a huge opportunity.
How do you envision this initiative transforming cleaning industry practices, and what kind of a timeline are you looking at?
The timeline is short. We're doing this really in an intensive way in the next year. We're looking carefully at what other people have done that works. So we start off with a phase we call exploration. We're going to be reaching out to people in the ISSA industry to say, what do you do currently for training? What languages do you train in? What works for you? And we're going to connect the lessons learned to the gaps identified. And the gaps will be identified by talking to industry leaders and also people that are making procurement decisions, buying the products, and people that are using products. So we're saying, what do you see as to what's working and what isn't working? And then from there, we're saying, what are your ideas as to how to do better training? And then connect those into training videos, training sessions that then can get to the ISSA website, which is this amazing dissemination platform. A lot of people can go there to find their information. So we're going to ask, we're going to listen, we're going to innovate, and then we're going to reach out.
A lot to do in a year. Gavin, can we do it?
Yes, we can, because it's the power of collaboration, Jeff. And it's the power of collaboration through ISSA members, as well as working with two fantastic universities, one at Penn State and City University of New York. And that power of the people, the different skill sets that we have, and the different networks that we have, and the communities we're going to create, and the partnerships is going to it's going to be a fantastic journey, 2025.
Mm-hmm. It'll be good to see. Becky, back to you, and then we'll go to Omrana. What types of tools or training are being created to help businesses adopt safer choice certified products?
A lot of different tools. We're talking to people of all ages. I've learned about TikTok. I mean, turns out that there are some people that get their information from a TikTok video. And we have people on our team who are in their 20s, and they think the way to train people is with a TikTok video. We talk to people in their 40s. They have a very different view. Some people want to see it on a screen. So there's no single way to train people. But what you need to do is understand how and when training occurs and how good information gets transmitted. And once you understand that, you can design very effective training, and ISSA can then disseminate it, send it around.
Yeah, I've tried TikTok a few times, but I'm not too good with it. Omrana, you might TikTok.
I actually do not, but
Oh,
my students tell me at the School of Medicine that a lot of our patients, especially those that live in low and middle income areas of New York City, get a lot of their health information from TikTok. And I think that that is likely to be true for a lot of people who are at the end users, both of the products that we are talking about, but also the end consumers for the training materials, so the actual cleaners. And I think that the fact that we can approach this in a variety of different languages, that is part of the strength of this collaboration. The fact that we can approach this in a variety of different ways, in terms of the output, whether it's TikTok videos, it's written material, it's video training type of videos, will allow us to reach a maximum number of people who are actually the target audience.
Mm-hmm.
So I was walking through airports and I've been looking at the cleaning staff in an airport. They all have phones. Their cleaning products may or may not have a label on them all around the world. They may or may not have, they certainly won't have a detailed material safety data sheet on their cleaning cart, but they all have phones. So we need to think about how to train with the resources and products and tools that a cleaner has with them at all times.
Good information. Yeah, everyone has a phone. We all can use them to access what we need, that's for sure. Let's talk about a little bit of manufacturing. Where are these products manufactured? So many of them, and more will be added to the program. Gavin, talk about that and what this means for this program.
Yeah, really important question, Jeff, because when we talk about eco labels such as the EPA Safer Choice, what is that?
Mm.
And the real important point is that nearly all of the EPA Safer Choice products, over 2,135 products, are actually manufactured here in the US. So they're by American US companies. So when we're talking about this, I'm going to hold up a product, Jeff. This is a product that I use. That little label, if you can see that label there, that's the Safer Choice label. And one of the challenges that we have in our project here is to see what is the awareness of that label. So how do we increase knowledge, demand, and use of these products if you don't know what the label is? And the label is not just the point that in those products there are safer chemicals, safer ingredients for cleaning, but these products have been evaluated for performance. They have recycled content. So every manufacturer has to make these products with at least 95% recycled content. There's an air quality component in the criteria under the Safer Choice standard that each product can't expose or release anything that's 10 microns or less. That's those particles, Jeff, that we can breathe in. So that has to be tested. We look at waste products, we look at packaging, we look at performance. Each product that carries that label must perform as well or better in comparison to leading brands that already exist without damaging the surfaces, without influencing the air quality. So it's that increasing that knowledge, Jeff, of that label. Then, as we saw with both the federal government and now the Military Reauthorization Act, there's going to be change in contracts. And as Becky said, then we've got to work out how do we use those products and how do we use them in the way that the manufacturers designed them to be used. And that's going to take a collaboration. That's going to take partnerships. So again, label recognition is going to be the key. We're doing baseline surveys and focus group discussions now in both New York and Pennsylvania to learn how do people make decisions on what gets cleaned, how it gets cleaned with what product, how do they buy and purchase those products, then how do they train to use those products?
And we really are seeing that a little knowledge goes a long way. So a member of our team who was brought on board for a very specific knowledge that he'd never heard of the label. And he came back the next week and said, you know what? I've got that label in my cleaning products. So he was, once he saw it and got interested in it, he was able to see it in a completely different context in his daily life as he was looking at his home closet.
Yeah, it's the impact of what everyone's doing here.
Yeah.
Omrana, anything to add to that?
So, I think one of the key points that really is a strength of our project is the fact that we are moving up and down the value chain, as Gavin has taught me it is called, from manufacturing all the way to the people who do the actual cleaning. And the cleaners may have never heard of these manufacturers. They may not know anything about where the products that they are using are coming from, or sometimes, unfortunately, even how they should be used appropriately. So helping to make those links along the value chain, I think will be one of the key strengths that we'll bring to this.
Omrana and Becky, I want to ask you both this question. Omrana, you first. Are there benefits for businesses that switch to safer choice products? Because they're going to wonder what's in it for them.
Well, I think that there are two things that I really want to highlight. One is the health benefits. There are known harms that can occur to people, there are known risks that with some of the less safe cleaning products that are out there, including skin diseases, skin damage, lung diseases, eye irritation, endocrine or glandular disruptions, and also carcinogenic or cancer-causing effects. These are what are known. For my interest as a women's health person, what is not known is what the impact of these some of these unsafe products is on the fetus, on pregnant women who are involved in the cleaning industry. So there are both harms that we know about and harms we don't know about that can occur when people make choices that are less safe. The safer choice products, making safer choices means a healthier workforce, a workforce that has fewer harms coming from the products that they are exposed to. And I think that is sort of the biggest advantage. The second thing that I was really interested to hear, and I know that a lot of people who are involved in the cleaning industry ask this question, is are these safer choice products as effective at the cleaning? Will I have to work harder? Will I have to put in more elbow grease if I use a safer choice product? And what we're saying to them is no, they are as effective or more effective than less safe alternatives. So I think that those are both advantages that companies that switch to safer choice products have.
That comment is what we heard with the green cleaning movement years ago when products were brought on. People had that same question. Are they going to work as good? Thank you for answering that, Amrana. Becky, anything to add?
Uh, I've worked with companies who were addressing health issues in their workplace. And the thing that I've learned time and again is that when you pay attention to a process and make it better, make it more efficient, make it safer, you may start by doing it for the health of the people doing the job. But oftentimes it translates into a better process, a more efficient process, and so a more cost-effective process just for the job itself, to say nothing of the avoided cost of a health harm to a workforce. So I think that this project is a very sensible one, as borne out by previous projects I've been part of.
And Gavin, what would you say to this? Anything else?
Yeah, just one thing, Jeff. One of the key strengths of this whole entire Making Safer Choices project is that a trade association, ISSA, is collaborating with university professors that are really good at research. They're really good at identifying what the current knowledge is, the attitudes, and the barriers to purchasing and using cleaning products. And that's going to drive us forward. A lot of these questions that we're talking about sound fundamental, but they're not. They just haven't been asked. And they haven't been asked, Jeff, at scale. And when we go to scale and we cover schools, hotels, government buildings, military installations, airports, stadiums, convention centers, beauty salons, churches, all the different sectors that we're going to penetrate, we're going to get some really interesting answers that will work with the university professors to say, what's the solution? What's the next step?
There's a willingness to look at this area in the cleaning industry. I say that because I see patients in clinic who have lung injury, and they reflect on their work and they say, I could have used a better product, but I didn't know better. And but there's a willingness of people to do the job well, do their job well. They want to clean. There's a strong sense of professionalism among cleaning people who do cleaning, but and also a willingness to protect their health and to take the steps to get the training to know how to protect their health. And I think that's what's so much um, fun, really, about this project is to connect to people who are on the ground, like ISSA is, and people who think about groups of people like Omrana does, and people who listen to people's lungs like I do. I think we're all in it to work together.
Thank you for that. Let's stay with you, Becky, on this next question. We'll wrap up in a few minutes. This project is focused on two states. We talked about that, New York and Pennsylvania. What strategies have you been talking about with your team there and with this group to ensure the longevity and scalability of this beyond Pennsylvania and New York?
Yeah, that's a great question because what we don't want is to do this work and then have it stuck in a closet or in a paper and not be out there working for people. And the ISSA dissemination, they've got this, they've got a reach. ISSA has a reach. And if we put together products, podcasts, things that are available, that someone can go to a link and find it, they can get their information. It'll be there. It'll be a multimedia library, if you will. So that's number one. Number two is we're going to figure out where a podcast online will be fine and where person-to-person contact is needed. And so we'll be able to make recommendations about how to move this thing forward. And then ISSA, through their members, can share that information and figure out how to make sure that this project has legs.
I like that because we want to see this grow and get bigger and better.
Yeah.
Gavin, anything to add to that?
I think it's really important, Jeff. This is important, and as Dr. Arana said, the value chain that's that entire cleaning industry, the users, the purchasers, the retailers, the product formulators, the ingredient manufacturers. If there's one thing a trade association can do really well is we can collaborate and bring everyone together under a partnership with purpose. And that's what we're focusing on, a partnership with purpose, working with academia, with university professors to answer some questions that we just don't have the answers for right now.
Mm-hmm. Amrana, let's ask you this last question, then we'll get Becky and Gavin to add. Because at the end of the day, we have to know it works. How do you measure the success of a project of this scale?
I am a huge believer in the forgive me because I'm not a native English speaker, so if I get my idioms wrong, but the proof of the pudding is in the eating. We need to see when Becky is walking through airports in the next year, at the end of this period, and perhaps after a second project to upscale this our work, does she see safer choice products on the cleaning carts in the airports? Are we really able to increase the uptake and usage of safer choice products? And we won't be asking Becky to walk airports across the country, but we will try to measure uptake through ISSA members, an increase in uptake of safer choice products as the final or one of the final measures of our success. Are more people buying it? Are more people using it? And are more people aware of it?
I personally volunteer to walk the airport like in Hawaii and look for products if you want me to. So I think there's
But
volunteers out
second,
there.
Jeff, you're second on the list. I already,
Oh,
my name's already up there.
I can find other nice warm tropical places if, you know. Thank you, Amrana. We appreciate that. Becky, what would you add to what Amrana said?
Uh, when something takes hold, it often takes hold on many levels, and it takes a while to watch it grow. And so I think we're going to be monitoring things at all the different across the value chain, and continue to monitor what's working and where the gaps are. I think we're in this for the long haul, but we want to make a difference in the short term.
Absolutely. And we're going to wrap up our session today. Gavin, uh, share your thoughts here and maybe a call to action for those watching. What should they do? And with that.
Well, Jeff, this is the beginning of 2025. By the end of 2025, it's all about storytelling. It's about being able to listen to narratives on how people clean and how they made those decisions to clean. This project has been, again, so much work and thought has gone into this with the three partners. We have a plan. We're going to conduct surveys and focus group discussions. We're going to look at the current knowledge and attitudes and barriers to purchasing and cleaning and using cleaning products. We're going to develop community-designed education and training solutions on purchasing and using safer choice products. We're going to package all of that into toolkits, playbooks, and videos. And as Omrana would tell me, we're going to make sure that language is not a barrier. Other social issues aren't a barrier. The location where you live is not a barrier.